Welcome to this week's program. I'm Shannon Loehrke. The number of opioid-related deaths continues to climb across the United States and in Minnesota, with the CDC reporting at least 91 deaths from overdose per day. A bipartisan group of lawmakers wants to reverse the direction of this epidemic. To talk about the Opioid Reform Act, Representative Dave Baker now joins me in the studio. Welcome.
Thank you, Shannon. It's great to be here.
You were the lead sponsor of the House measures in the Opioid Reform Act, and you've taken on this role in part because you lost your son to opioid addiction. How did he become addicted?
He had a back injury. I think we've heard that 1,000 times. He was an athlete. He was in high school and was a good athlete. And actually, we didn't even know exactly when the injury took place, but through the summer of his, probably his freshman year at St. Thomas, his freshman year at Normandale, he just was having some back issues and went to the doctor and got some pills. But I'll have to tell you that the doctor that prescribed him to us, our family physician, was very clear with Dan. Be careful with this. This is very addictive stuff. And my wife Mary was with him almost every single visit after that because we just knew this was a pretty big deal. So it just very slowly, like some other families that you hear about, this spins out of control. The same 2 pills that day didn't make his pain go away. It took 4 pills. And then it took 6 pills. Because your brain starts saying, I need more of this to get you to feel normal again, Dan. And so he struggled with this and eventually, went through a couple treatment facilities and had to drop out of St. Thomas when he was a junior. He had a great future ahead of him. And we lost him literally about 3 years from when the first time he took it to when he actually passed away of an accidental overdose of heroin. And to imagine our son, who was, I thought, growing up in a really good family base and a lot of church and a lot of sports and a lot of clean living, my gosh, we're not perfect by any means, but it just blew our minds to think for a second that we actually lost one of our kids to this disease that I didn't really recognize until we lost him. And so we've created a foundation. I've gotten busy with a lot of other things in my life to tell people how important this is to understand the strength of an opioid pill. But also to try to talk about the stigma of what addiction is and what it isn't. Addicts don't wake up and say, I want to be an addict today. They hate themselves because of the shame they bring to the family. And they're embarrassed because they can't stop taking it, because they get really sick. So this stigma of addiction, we need to make sure people understand this is not something that just people arbitrarily want to be. But when you take these pills for the first few times and you haven't tasted this euphoria before, some brains trigger differently. Some get sick or some don't like it. Some go, wow, this is amazing. I want more of this. And so this opioid crisis is real. And people who have never taken it before, and yet I would call these naive patients, I'm trying to stop it from even getting the taste to them. There's other forms of pain relief that we can start talking about. And my communications with the medical community has been straightforward. I'm challenging them to be bold. They are doing some really good things out in Minnesota. But we need to do more. We've got to start slowing down the prescription pills that are being prescribed. Again, dentists, 2016.
Yeah, high school kids getting their wisdom teeth taken out. They're often given opioid prescriptions. 30
or 60 pills. One of the bills that we're talking about
really
here is limiting. It's I don't know why they're doing that. You are hearing 60, 90 pills in a bottle, and I don't know why anybody needs that. So again, we are being very straightforward and being honest with the doctors because they were lied to. They were duped when they were told from the pharmaceutical companies this is not addictive. And so they feel horrible about this, and they need to make that change, but they're the ones who now control the floodgates. They do it, and they're doing a better job.
The pharmaceutical companies control the floodgates, is that
No,
what you're
the
saying?
doctors.
The doctors. Oh, I see what you're saying.
The prescribers.
Okay.
So they control that. Hey, the drug companies are making as many pills as they can possibly make right now. They can't get enough money in the bank. Congratulations to the family that owns Purdue Pharmaceutical. They're the 16th richest family in the United States now because of OxyContin, which is a company that pled guilty and paid a big fine because of their horrible actions and because of their horrible deception to the medical community, which is a community that we've always trusted. They were duped and they were lied, and I guess we can't solve this now until we put those folks to task, the pharmaceutical companies, and we tell our doctors and our prescribers and our dentists, we need your help to get our kids back and our families back.
We've touched on this just a little bit, but last year the Centers for Disease Control developed guidelines for prescribing opioids for chronic pain, which is essentially what we're talking about. what is the doctor's responsibility? Because they are the ones prescribing. Granted, the pharmaceutical companies have marketed it to the doctors, but they're the ones writing these prescriptions.
Right.
Will this help? Will these guidelines help?
They will help. Doctors work on research and scientific data. That's how they think, and that's how they practice. And I do want to say this: there is a place for opioids in medicine. Short-term evasive pain when it comes to surgeries, or there's some real bad accidents. You know, you break a leg or two, it's a really severe accident. There's a place for this. But what they don't understand is when you are on an opioid more than 30 days, your brain starts to trigger things differently. There is a place for this with long-term care with cancer patients and with
palliative care.
Yes,
yeah.
There really is. So I don't want to blanket this like anybody who's taking an opioid for good reason is doing something wrong. They're not. It's the folks it's the prescribers that are just giving them 60 pills because I want to make sure your pain's okay. You go away, and if I see you in a month or two, I don't even think about you, the pills you used. So we have to make sure that anytime there's refills on these things, there should be a check. There should be like, hey, how is your pain? And
there already is a prescription monitoring program, and one of your measures would require that the doctors actually have to use it, which surprises me. It seems like they should already be using it.
Well, a lot of them are. Last year we passed a bill that required all the doctors that are prescribing any kind of a Schedule II drug, they have to at least have a login account at the prescription monitoring program managed by the Board of Pharmacy. So far today, there's about 39 or 42% of doctors are into that system, which tells you 60% of the doctors haven't even gone there to sign up. Mm-hmm. That should frighten people, because a lot of doctors I know are busy, they're overwhelmed, they don't have time to go to another database and check on a person who might be doctor shopping. The point that, and one of the bills this year that I have, it's actually being introduced here later this session, is the requirement of any doctor in ER care, emergency rooms, or urgent care have to check every single patient that comes in, because right now there's not a patient-doctor relationship with that patient. So even the Minnesota Medical Association is getting behind. So far they've been really reluctant to try to get behind anything that tells the doctors what to do, and I understand that. But this is a bill that we need to start doing this, and again, more large clinics, healthcare operations are actually doing this now internally themselves, but we need to make a state law because there's a lot of docs that are not doing it.
The Steve Rumler Hope Foundation has been active in promoting a measure that requires drug companies to pay a licensing fee to the state based on annual sales of opiates. What is the goal of this bill?
First of all, the Steve Rumler Foundation is an amazing group. They have got so much passion, and I am so behind this, what we call the stewardship bill. What they are trying to recognize is, look, these horrible drug manufacturers that have, again, duped our medical community, as we've talked about, they're trying to say, how about giving us some money back for the damage you're doing to our society? Right now, drug companies pay $235 a year to sell a drug in Minnesota. I think that's a crying shame. I think raising at least the license fees to $100,000 a company if you want to sell an opioid in Minnesota ought to be something we talk about. Now, one of the bill's ideas are to do a 1 cent per morphine equivalent, which would raise about $20 to $40 million in a biennium. That money could be used for treatment. Money could be used for education. That money could be used for a lot of things. But right now, the drug manufacturers are having a heyday because they're selling Minnesotans a lot of opioids. And again, my goal is to have doctors and folks reduce prescriptions to opioids by at least 50%. I want to start talking about hard numbers, and I think people are starting to see some reductions in that, but our deaths are still going up. And I am not seeing enough from the drug manufacturers in helping us get this thing turned around. They put up some warnings on their websites, but they're not doing enough to, I think, really start saying we have got to redesign this thing. So I really am grateful that somebody brought up an idea that we can go after that. My concern, however, is that we can put any kind of a tax or a fee on a morphine pill if we want to, but they are going to be just worried about their bottom line, and they're going to go right to the end user, which is the patient. They're going to end up paying more for that. That's what my concern is. So we got to find the right way to hit them without them hitting the customer, and that's what we're trying to get to.
Well, and pharmaceutical companies are already pretty aggressive in their marketing of the products to the doctors and to society. I mean, we have drug commercials now. Do you think lowering their profits by adding this tax, now you said it might be passed on to the consumer, but could they be inspired to change their business model?
I sure hope so. I hope that if we shame them enough, quite honestly, that they might look back in the mirror and say, you know what, we ought to deal with this thing more directly. We got to come up with embedding the PMP program into electronic medical records so that doctors can actually right there on their own website and their own computer in their exam room to say, click, I can look at it much easier now. They have never brought anything to the table. They're not helping, but they will tell you that, oh, we give Minnesota a lot of discounts for their medical assistant customers, and how great are we for giving all these discounts to the cost of taxpayers. Well, don't hurt yourself patting yourself on the back, because I have no compassion for drug companies that are still reeling out these pills in a way that I don't think is responsible. Now again, there's a place for this. Pain is real and pain can be managed, but we can't just wipe away pain, because your level of a pain at an 8, Shannon, is different than maybe my level 8, and you don't know what that is.
Sure.
And if you're trying to get drugs for a different reason, your 8 might be exaggerated, or maybe a 9 or 10 when your brain doesn't know how to know what pain is any longer. So we've just got to make sure we keep talking about this. We want the companies to come forward. We want our medical community to still come forward and help us with this. But let's talk about this openly and honestly, and let's not let any more families go through the horrible loss. And there's communities that are being ripped apart with this whole thing. But I will tell you, there are some glimmers of hope, and there are things that we're trying to continue to do to bring this message to Minnesotans, and especially the young folks. I'm trying to get to some town halls. Sheriff Stanek is doing a nice job getting to high schools, talking to people that are 23 and under. Their brains are not fully developed, and their cortexes are not fully formed, and so they react way more susceptible to addiction. And our kids and our parents need to understand this early on. Our son started taking a pill when he was 19 years old. Wow, I wish I would have known that, how dangerous and how susceptible he was at that time. I'm in my mid-50s. It's going to react to my brain differently because my brain is much more old and more mature. So it's just, science has shown us that. So opioids are a big deal right now, and the more we talk about this with our communities, the better off we are. But we've got to hold drug manufacturers accountable for what they have done, and not just pay a fine in a judicial court and then just keep racing to the bank, because nothing has slowed them down in the profits that they've made and the damage that they're causing to our communities. So if I can say one thing to the drug manufacturers, when are you going to step up and help us out? Because we need your help a lot. And until that happens, I won't stop my mission on this thing.
Representative Baker, I want to thank you so much for taking the time today.
It's been an honor, Shannon. Thank you so much.